Hey everyone, in this episode, we're talking about an effective chart audit. What is involved in an effective chart audit and how can you do it and do it really, really well? Having an excellent chart audit process ensures that you provide your patient with very organized, strategic, high quality care. And that is exactly what your patient's expectations of you are. And that's exactly what your expectations of yourself should be, providing the standard of care. And doing a chart audit will really help you reduce the risk of doing something incorrectly or wrong. It improves communication and reduces stress for everyone involved in patient care. So I challenge you to create a structure on chart audit and tune in to find out what it's all about. Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I am here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. Welcome, so glad to have you. Hey, are you in dental hygiene school or just got your acceptance letter and just started dental hygiene school and you're worried about how you're going to fit it all in, what the evaluations are like, what the key strategies you need to set up in order to be successful? You don't want to have worked all this time to get accepted into dental hygiene school only to make some pretty major errors in your first and second semester. I've put together a course that will really help you set yourself straight right out of the gate and get yourself started on the right foot in dental hygiene school. Whether or not you're just entering school or you've done your prerequisites and you're just well on your way halfway through, this course is designed to help get you straight and keep you straight so that you can become a dental hygienist. Click the link in the show notes and check it out. Let's give some conversation and time to an effective chart audit. Are you doing a chart audit on your patient before you walk out to the reception area to greet them? So, what is a chart audit? It's a comprehensive review of that patient's record. It provides you, the clinician, with the information in order to determine what is the best first, second, and next step course of action that's needed for this patient in order to provide safe care to that patient. This is all about reducing risk and increasing your preparedness to treat the patient effectively. And the more you know about that patient and that patient's needs before you walk out to the reception area to greet them, the lower the risk of the appointment going in the wrong direction are. We need to know the patient's treatment needs. What was their last treatment? When were they here last? What was performed? What was done? Were there any concerns noted in the chart? Did everything go smoothly? Is there anything pending? These are the things that you want to be looking at when you are performing your chart audit. So we're going to take just kind of a really detailed look at that chart audit so that you can be best prepared to look at the chart before you see your patient and say, okay, what's important? What do I need to look at? Think back to when we talked about your notes, your AETN notes. That last line of your note, the N says next visit. What are we doing next? At the very minimum, that's the first thing you should be looking at. Where did I leave off on my patient last visit? And what am I doing to treat this patient today? What did I say the next visit was? And is this the visit? Maybe they were seen by the dentist in between their visits with you. So take a look at your N. What did you write last visit under the N for next visit? Now, a lot of people think it's a good idea to have a checklist when you are performing a chart audit. It makes it a little bit easier for you to remember all the things that you should look at, and it makes it very comprehensive so that you don't miss anything. So if that's something that works for you, then create yourself a checklist. I tend to like to look at the last visit. What did I do last visit? And what did I write under my N? And then I'll take a look at the treatment plan. Is there anything pending on the treatment plan? And then I'll go into a different series of things. And this is really unique to each person. So I want to encourage you to create your own comprehensive checklist. And I've seen lots of people have their own checklist, and it works well for them. I like to go through my entire schedule of patients and go through all of the different things in the sequence. Look at my N, look at the last visit, look at the medical history, look at the radiographs, take a look at the treatment plans, and write some specific notes about what the patient's needs are for today. Are they going to need their radiographs updated today? Do they need their medical history updated today? Is the HIPAA consent form signed in their chart? What things do I need to do today when I see this patient? What is missing from their chart, if anything? This is all part of your quality assurance and preparation mechanisms that you can do to ensure a great, comprehensive, thorough visit with your patient. So think about your checklist as you make your own very own checklist. And if you're starting with your N, if this is a recare patient or someone that you've already seen before, you're looking at what you did last time they were in or what was done the last time they were in. Maybe they saw a different provider. So, what was the reason for that last visit? Was it a routine visit or was it urgent care? And what was done? What treatment was performed? You may want to have this information so that you can ask the patient about it. Maybe they had a restoration placed on their lower left. So, if you're aware of that, when you greet your patient and bring them back, you can be sure that you ask them about that treatment and how's everything feeling and how did everything go. So that follow-up conversation that just naturally occurs with that patient, you only have the opportunity to do that if you're prepared. So you have to know and look that up, make a note to ask the patient about that last visit so that you can follow up. And then if they have any concerns about that treatment that was done, you can make note of that and address that issue. Take a look at the radiographs, the last radiographs, the date, the type of radiographs that were taken, and are they current based on your patient's risk? If they have a high caries risk and you look at the radiographs, are they outdated? If they have a low caries risk and you look at the radiographs, are they outdated based on the needs of that specific patient? Then you can make a note as to whether or not you are planning on taking radiographs today at this visit. Now, that may change once you see the patient if they provide you with different information, but at least you are prepared going into the appointment when you've done your chart audit that you have an understanding and an idea of the radiographs that are needed. The last visit when the patient was with Hygiene, what type of visit was it? Are they a periodontal patient? Are they a healthy patient? Was the periodontal chart done? Does it need to be done? What type of patient are they? Did they have periodontal therapy last time they were in? And this is a follow-up reevaluation. Are they in the middle of hygiene treatment where they've started periodontal therapy and you're doing another quadrant? What type of local anesthesia was used? So think about how learning all of this information about your patient provides you with so much information before you even walk out to the reception area to get that patient. Medical history concerns. Take a look at the last medical history. Make sure you check to see if it needs to be updated. Was there anything of concern on that patient's medical history from last visit? Did they need pre-medication? Are they taking a blood thinner? Do they have artificial joints? Did they have a recent surgery? Are they a smoker? Were there any medical alerts at that last visit noted on the medical history that you need to be abreast of? Maybe they're a diabetic patient, and so you want to be sure to ask them if they have their recent A1C tested and what was their blood sugar this morning. When did they eat last? So these are all things that you need to know in order to know what questions to ask your patient when you bring them back. Now, does this patient have any pending treatment that was recommended that hasn't been completed? And if they do have pending treatment that hasn't been completed, be sure to find out the why behind that. What was the reason why they never scheduled that treatment to be done? Is it noted in the chart, or do you need to find that out today and note it in the chart? And what's the patient's overall health status, their general health? Review the patient's record for clinical findings. What's their diagnosis? What are their treatment plans? And what are the patient's actions? Remember, you're responsible for this good record keeping, and you want the record keeping to be as accurate as possible. When you look at the medical history, if it needs to be updated, then it needs to be updated. Were they seen since somewhere else? Find out if they saw somebody on an emergency situation. Ask that patient if they've seen a specialist. These are things we need to talk about, right? That's their dental history. So not all the treatment might be evident to you in your office. If that patient was scheduled with a treatment plan for a root canal, they may have seen the specialist and had the root canal completed, but you haven't received the follow-up paperwork referral from that doctor. So this is where the right questions, asking the right questions of your patient, really helps you close the loop on discovering and understanding all the different things going on with your patient. Be sure to look over the entire previous notes for the communication information that you had with your patient. Did we provide the right information? Did we provide a recommendation of a product or a referral to the patient that requires that follow-up? Do we need to have a conversation about a product that our patient started using last visit and find out if they were compliant, or maybe they had some challenges with use, or finding that if it was something that we sent them out to find out in a store somewhere? Communicate with your patient about these things, but doing your chart audit helps you understand what it is you need to ask. It's all about asking the right questions. And in order for you to ask the right questions, you have to be prepared to ask the right questions. Now, one other thing I just want to mention, it's really challenging when you haven't done the chart audit, but you're asked to do a procedure on a patient, maybe that's in another operatory. For example, maybe the dentist has asked me to provide local anesthesia to a patient in another operatory. I'm going to rely on the dentist to look over the medical history and make sure that the patient is safe to treat so that I know what local anesthesia I'm going to use. And one of the systems that worked really well in an office that I worked in was we used different color bibs for different types of patients. Because we were all in and out of different operatories with patients and different providers provided different care, we needed to be able to communicate with one another the findings of our patient. And so one of the ways in which we did that was to use different bibs. So if we had a patient who had a cardiovascular issue, for example, and they required no epinephrine, maybe we had those patients in a pink bib. And patients who were safe to treat with epi used a blue bib. This is just an example of a way that you can communicate with other providers on different health issues when you've done a chart audit. So you do your chart audit and you put out the right color bib that goes with that particular patient so that it reminds you when that patient, when you go out and you get your patient and you seat them in your operatory, that patient gets that type of bib because they're higher risk or they're lower risk. So you're starting the entire appointment off by knowing that information ahead of time. And then learning more about your patient once they're in the chair might reveal additional considerations or cautions that you need to take in order to treat your patient safely. Doing a chart audit is all about patient safety. You want to be as prepared as you can be and understand the most amount of information that you can possibly know about your patient prior to going out and getting them to seat them in the chair. This is all about you being prepared to see each and every patient. You should know exactly what you did last time before you walk out to get your patient out of the reception area and exactly what you plan to do at today's visit based on your findings of your chart audit. Now, that may change once you've done your assessment, but it's always good to confirm with your patient, you're scheduled here today for ... whatever it is. Last time we saw you, you had this done. And how's that feeling? So you want to make sure that your patient knows that you know them And sometimes just having the conversation as confirmation with your patient that you've done the chart audit shows them that you're prepared for today's visit. I can't tell you how many times I've seen a patient in the chair and I say, "You're scheduled today with me for your periodontal maintenance visit. And you're also scheduled to have your bite wings updated." And the patient says, "I thought I was here to get that filling done on my upper right. That's what I thought I was scheduled for today." So it really helps reduce the confusion that might happen sometimes between providers and patients if you do your chart audit and then you relay some of that information back to the patient so they understand exactly what your plan is for today. And then you can meet that challenge and address that issue if there's a discrepancy between you and your patient on that day. So take advantage of using your chart audit information to have the right conversation with your patient and ask the right questions of your patient so you can clear up confusion and answer questions before you even get started with your visit. That will make things go so much smoother for you as you work ahead with your patient care. Are you looking for study sheets? I've created study sheets that cover the content of this episode. If you're interested or that's something that's going to help you on your learning journey, you can click the link listed right in the description of these show notes. Happy studying! I would invite you to send me any questions that you need answered. Questions come up when you listen to this podcast. I have a link in the show notes, and I'd be happy to answer any questions that you have. Also, I would appreciate a review if you have time to leave one. Thank you so much.